This is Plant-Based Kidney Health, and we're doing a quick 30-minute live Q&A. So you guys can go ahead and put your question in the comment box, and we have some it ahead of time. Yep. Okay, Dr. Hashmi, starting this off, we did get a question about tubular acidosis and any specific diet recommendations for that. What is that? And then we can kind of get the diet side.
So when we start to talk about things like renal tubular acidosis, there are several types of RTAs that are present, and what ends up happening is what we're trying to do is to reduce the load of acid that's going to end up going on to the kidneys. And I hate to say and sound like a broken record, but as you know, on this channel we've talked about the role of increasing plant predominant diet. So in other words, the more you're able to add plant-based foods to your diet, the better you're going to do. As kidney disease worsens, for example, one of the treatments that we do is we give people sodium bicarbonate. Now, why don't we just get rid of sodium? Well, we'd have to replace it with a different molecule. And you can't necessarily give people potassium bicarbonate because usually they have potassium retention. So in other words, bicarbonate, or a simple way to say it is baking soda. What you're trying to do is increase the alkalinity inside your blood. That will also translate into improving the renal tubular acidosis, because your body is trying to get rid of all that acid that's building up inside your body through your kidneys.
Yeah, and just to reinforce what you said, diet standard, that's where less of the animal foods and then more fruits. Am I echoing on your end?
A little bit, and I'll see if anybody says anything about it.
Yeah, let us know in the comments. Karen asked Dr. Hashmi, what role does magnesium play in kidney health and chronic kidney disease? And then what are some good sources of magnesium? Their magnesium blood levels are low.
All right, so I'll let you answer the food sources of magnesium. Remember, for magnesium supplements, there are 10 different types of magnesium out there. So in addition to the common ones that people know, mag oxide, there's things that are a little bit less common, like magnesium glycinate. The glycinate is supposed to help you relax and calm down. So mag glycinate is great for people to use in the evening where they can help to relax. Magnesium serves as a cofactor to so many metabolic processes in the body. So as far as overall health goes, Michele will give you all the information about the food choices. But the bottom line with magnesium is eating a diet that's rich in magnesium will help with things like high blood pressure, which translates into the better your blood pressure control, the less scarring you'll have of the kidneys. So there are a number of multitude functions of magnesium. Magnesium threonate, for example, crosses the blood-brain barrier very well. It's been shown that it can be helpful in terms of overall cognitive abilities as we get older. It can also be helpful for things like migraines. Magnesium in general can help with migraines, so a lot of migraine sufferers will use it. In terms of kidney disease, it's not like if you took magnesium, you're going to have this miraculous process, but it's just another tool in your toolbox that will help.
Yeah, and I think a lot of people in general don't get enough magnesium in their diet, and especially people with kidney disease that might be restricting certain foods. And those magnesium foods are your beans, so legumes, beans, pumpkin seeds, avocados, dark chocolate or cacao nibs. Those are all going to be magnesium-rich foods. Sometimes magnesium-rich foods are more potassium-rich foods, but again, it just comes down to the portion you consume and your individual needs. But it's definitely an important nutrient to be getting diet. Dr. Hashmi, we have a question about the medication Jardiance, and just what do you think about Jardiance and what side effects should we look for?
Yeah, so first thing is Jardiance is a phenomenal drug, and Jardiance, the other name for it is empagliflozin. Farxiga is another one of the SGLT2s. These are sodium glucose transporters. And so SGLT2 inhibitors is the category of drugs. And what happens is when you go on these drugs, the simplest way to explain it is it's going to make you pee out sugar. And so the reason this is so effective is that for reasons we don't understand, it helps, of course, with peeing out sugar. It helps your blood sugar. So if you're a diabetic, SGLT2 inhibitors are great. We also know in kidney disease that it also helps with delaying the progression and improving kidney function in some cases. We know in heart failure, SGLT2 inhibitors play an important role. We know that it causes a little bit of weight loss, so it's an excellent agent in diabetics instead of some of the medications that we currently use, like glipizides of the world that cause weight gain, or insulin of the world that cause weight gain. But like every drug, there are some very serious side effects you want to be aware of. The first understanding is because you're peeing out sugar, if you hold your pee, you're not going to the restroom regularly. Let's say you're like me, you work 8, 10 hours straight, or sometimes 12 hours, and you're not going. Holding your pee can increase the risk for bacteria to grow. So, bacterial urinary tract infections is a concern. Fungal urinary tract infections is a concern. In fact, you can get very serious, even life threatening infections in the groin area because of this drug. So, keeping that area clean, making sure you're peeing and not holding your pee. And of course, if you have any burning, any pain, any blood in the urine, or of course, if it's worse and you have any fevers or chills, you absolutely want to make sure you go get it checked out right away.
Got it. Thank you. We had a question in the comments. Do I count plant-based protein the same as animal protein, like yogurt, animal protein, plant? So yes, all of them will count towards your total protein intake, whether it's from a dairy source, animal source, or plant source. But what we do know is the plant-based proteins that are whole, minimally processed, so your legumes, your tempeh, tofu, ame, nuts, and seeds, are usually going to be a little bit lower in overall protein, and they're plant protein sources, so you get a lot of benefits. They're lower renal acid load. They come along with fiber and a lot of other vitamins, minerals, antioxidants. So there's still, 10 grams of plant protein contributes 10 grams of plant protein to the diet, just like 10 grams of animal protein, but there's a lot of benefits of the plant proteins over the animal protein. Let's see. Okay, I don't know, Dr. Hashmi, we do have a whole episode on Ozempic and, post kidney transplant, kidney health in general, but is there anything briefly you want to on that?
So guys, if you're thinking about Ozempic, what you want to understand that this is all specific for kidney transplant. Remember, in kidney transplant, your levels of immunosuppressives are critical. So, for example, if you're on Prograf or tacrolimus, you're on cyclosporin or Gengraf, all of those things have levels that we measure, and it's very important. With CellCept, we're not really measuring levels, but we're assuming that the dose we're giving you has a pretty good bioavailability. When you go on Ozempic, the main side effect is nausea, vomiting, diarrhea, or constipation. If you have diarrhea, obviously the medicines you're taking could actually go right through. Therefore, you can achieve a subtherapeutic level, increasing the risk of rejection. On the other hand, if you have constipation, there's nothing that's really moving. On the contrary, the same medications you're taking sit around a lot longer. They can absorb a lot more. So on both sides, you can get into trouble, and you want to be aware of that. The other stuff to keep in mind is a lot of transplant patients, especially if they were diabetic on dialysis, they suffer from GI side effects. So their gastric, which is a fancy way of saying stomach, their stomach or gastric motility isn't as good as, let's say, somebody who hasn't been on dialysis or gone through kidney failure. As a result, when you start patients post transplant on drugs like Ozempic or GLP-1, these drugs slow down food from going through your stomach. Since they're going to slow down food from going through your stomach, and your digestive system doesn't already work as good, your risk of nausea, vomiting, diarrhea, or constipation go up dramatically. And the challenge you're going to have is, even if you're vomiting, if you vomit, that can also affect your drug levels. So it's very important that if you are working with a doctor who, let's say, gives you Ozempic, please make sure your transplant doctor definitely checks your blood test within 2 weeks of starting.
Got it. And that's a good segue now into this question. But how does weight loss affect kidney health?
So this is tricky in that when you do weight loss, what the data ends up showing is that weight loss by itself, it actually doesn't improve mortality. Now, if you lose a bunch of muscle with it, in other words, your muscle mass goes down. What will end up happening is you're producing less creatinine. So it looks like when we measure your creatinine clearance or your estimated GFR, it looks like your kidney functions better. But the real question is it? So there's no doubt that weight loss will reduce the pressure on your kidneys. That's awesome. But keep in mind that as you're losing weight, more important than just losing weight is to make sure you're engaging in one, resistance training, and two, cardiovascular training. Because what the data shows, the single most effective way to reduce your all cause mortality is exercise. And that same thing applies to kidneys as well, is you don't just want to focus on weight loss, you want to focus on overall health.
Perfect. Okay, question about they're confused about fluid restriction. What is the daily limit and what counts as that? So I'll just say from a standpoint, if you're on a fluid restriction, like let's say you're on dialysis, you decrease your output, one, your clinic staff will tell you your actual fluid needs, but everything water, coffee, tea, almond milk, soups, liquids, anything that melts at room temperature is considered a liquid. People that aren't on dialysis or don't have a fluid restriction, then it can vary on what your needs are. Some people will say 2 to 3 liters a day. Kidney stone prevention is usually at least 3 liters a day. But ultimately, I'd say look at your color of your urine, pale yellow to clear in color, and then hot weather, working outside, exercise, all of those are things where you would need to increase. Okay, Beverly said, I have high potassium. What can I eat and how can I bring it down? So I guess from a standpoint of how to bring it down, Dr. Hashmi, you want to talk about that and then we can talk about food.
Sure. Well, okay, so you have three ways to bring your potassium down. The first way is eat less potassium. Easier said than done, I get it. But that's why you have Michelle. Second way is to get rid of it. You can get rid of it in the urine, or of course you can get rid of it in the stool. So for example, in the stool we have certain medications we give you. They're not the friendliest medication. Kxalate is one of them. There's a couple of others that we end up using, so that's one way. In the urine, we can use diuretics. Lasix, of course, is a diuretics. Lasix stands for last 6 hours. That's why it's called LA, L-A, for last 6 for 6 hours. So you can increase what's going out. And the third one is which is only for temporary, is to shift it. You can shift potassium from your blood into cells. And the only time we want to shift it is when there's a life-threatening emergency, and we just need to buy ourselves time so that Kxalate or the diuretics can start to take effect.
Yeah, and from a dietary standpoint, the thing to know is even a low potassium diet does not mean no potassium. It's usually anywhere from 2,000 to 3,000 milligrams of potassium per day. And so choosing lower potassium food options for a majority of your intake, you're eating higher potassium foods, smaller portion, less frequently, so that you fall into the guideline and then have your blood work rechecked to make sure there's non-dietary causes are addressed. All right, I'll try to talk less since it seems like there's a slight echo, it says. Okay, yeah, again, a couple questions about Ozempic, which Dr. Hashmi addressed already. Okay, any thoughts on kidney transplant taking a zinc supplement? And they're having a hard time losing weight on prednisone post-transplant.
So the prednisone part, just remember, it's going to stimulate your appetite. And if you're trying to prevent that from happening, once again, it becomes really important to have some kind of a plan. So, when we work with our patients for weight loss, we ask them, you want to understand every day when you wake up, if you have to decide what you're going to eat, you're already behind the 8 ball because you rely on willpower. Willpower starts to fade as the day progresses. The more the day progresses, the less willpower you have. So, in other words, if you know dinner is your weakest, which for most people it is, the reason for it is you're stressed out all day, you don't have a lot of willpower, it's hard to make decisions. And therefore, if you already have the food ready to go, Sundays you meal prep, you know what you're going to have for dinner, even if you don't, and you're somebody who likes to go out, fine. If you're going to go out, know what you're going to go out to, eat the same type of food. I know it sounds boring, but the more routine you can create, the more successful. Every Olympic athlete, when you look at their day to day routine, it is extremely boring, but it is very regimented. And the reason it's important is they never have to think about what the next step in their program is. All they literally have to do is just move and do the next step.
Yeah. Does long-term lisinopril 10 milligrams cause liver damage?
No, it does not. And we've had patients on decades. So I've been in this field now for 24 years, and I've been using lisinopril since I got into this field, but I can tell you no. We have patients on it for decades.
All right. Yeah, lots of questions, Ozempic. And so again, listen to the replay of this when you trust Ozempic, and we have a full episode on our page under the medication playlist. Let me see. At what milligram for Jardiance is appropriate for stage 4 CKD?
So it's not so much what milligrams is appropriate, it's about starting at the lowest dose. So we start at 12 and a half, or we tell our patients take half a tablet of the 25 milligrams. Why? Because we just don't know if they might get too dehydrated. Remember, it makes you pee out sugar, which takes a bunch of water with it. We just want to make sure you're not getting too dehydrated. There's an old saying in medicine, which is you can always make a small cut. This is what the surgeons say. You can always make a small cut bigger, but you can't make a big cut smaller. So whenever you're starting something, start small, see how you do with it, and we can always go higher on it.
Yeah. A few questions about zinc. Main thing I'll say is that could be a mineral that is low. And people with kidney disease are low in the diet. Plant foods, chickpeas, lentils, some tofu can be a good source, pumpkin seeds, quinoa. Are supplementing. You don't want to go higher is not always better. A smaller dose might need to be supplemented. If you're deficient in it, talk about that with your doctor or dietitian. Dr. Hashmi, are edibles safe for the kidneys with CKD or polycystic kidney disease? So basically, they
And
say no, that vaping or smoking isn't ideal, but what about eating it?
it's a great question because I honestly don't know. First is if they're going to stimulate your appetite and you're gaining weight on them, then obviously that's going to be an issue. If you're somebody who's not working out because of the side effects of that, that's going to be an issue. But I always tell you what I don't know, and this is something that I have not come across on edibles, and I have not been actively looking, so I could not answer that fully.
Yeah. And the only thing I'd say from a standpoint outside of THC or CBD and edibles is it's a baked good. So look at the phosphorus additives, the sugar, that sort of thing. Because that it could potentially be a higher source of that. What causes leg cramps at night while sleeping? I use pickle juice. Is that okay to drink? It seems to help.
This is a really tough question because, for example, dialysis patients get leg cramps all the time, and we try all sorts of things and we can't figure out why. It's not an issue of fluid sometimes. The first thing we think about is we took too much fluid out, and that's where they're getting cramping. Some other folks, their MAG levels might be low, and so we replace the MAG. Some other folks, rarely, they're on diuretics, their potassium is low, and they're getting cramps, and we fix that. But a lot of times, and I see this a lot of patients where they have leg cramps and we just don't know why. What I will tell you is that if you're somebody who's 110 years or younger, you got to engage in some kind of mobility work, which means if you can do, even if you do chair yoga, it doesn't matter, but you have to do mobility work. I can't stress how important mobility is to our overall health.
Yeah. And the only thing I'd add, like you said, say dehydration or low magnesium, low potassium, those are things that could contribute to it. So if you're looking at your diet, then look at that. Someone said, my numbers are stable. They the diet changes for all the information. Love that, Debbie. All right. Can someone with a GFR of 75 participate in plasma donation?
75 is normal unless you have substantial protein in the urine. So
Yeah.
yeah,
So any issues donating plasma?
they'll tell you. If you ever go, they'll tell you. But in terms of will it harm you, not likely. I
Okay.
don't think so.
Good. Another person plant diet and exercise has eliminated almost all their symptoms. Love that. Thank you guys for sharing. Um, what is the latest medicine for IgA nephropathy?
Well, there isn't so much latest, but we now have so many different tools in our tool belt. So in other words, if we're trying, Cellcept and it's not working, we have so many others that we can go down the road of. It's not like the old days. The old days was we just had prednisone. And yeah, you got a ton of side effects, but at least we saved your kidney. Now those days are long gone, and it's very rare that we get to a point of saying we don't have any medication to try. So, what I would say is not only do we have a laundry list of medications, we have a laundry list of combinations that we can try with medications.
Yeah. Several people say not pills help them. So, um, hey, if it helps in your cramps and it fits in your sodium need, why not? Okay. Does drinking 3 to 4 glasses of keto-friendly wine 2 to 3 times a month, is that deadly to PKD or does it hurt the liver? Or does it only hurt the liver?
Let's see, is it deadly to PKD? And it's
They're drinking wine basically a few times a month.
And
Um,
it's okay. So, a couple of things. First, we know that alcohol directly damages kidney health. In addition to damaging liver, it also damages kidney. In terms of keto friendly wine, in order for them to have keto friendly, what essentially means is they got rid of the sugar. So then comes the question is are they putting what I call alternative sweeteners? For example, the Splenda, stevias, or monk fruit, etc. And the dilemma you'll run into with these guys is several. First, they cause insulin resistance, they damage the bacteria in your gut, they can actually stimulate your appetite and cravings for bad food. So, the tricky part to life is people always want to know an absolute answer, and it's very tough to give an absolute answer. What we can tell you is if you're going to do it, just be mindful of the fact that a lot of things where they create these gimmicks to say this thing is less bad. For example, when they went from cigarettes over to what are those what do you call those things? E-cigarettes, right? It turns out e-cigarettes are terrible for you. And not only are they terrible for you, but now you got these teenagers doing it all the time. And so this is where just be careful about this stuff is, sometimes when we disguise something bad, it's still bad. It's just disguised.
All right. Let's see. Another positive, water, walking, exercise, sleeping more, and they're seeing great results.
Yeah.
Okay, let's see. Does kidney disease cause burning legs and feet?
Right, right. So remember, if you're getting burning legs and feet, that's usually a sign of neuropathy. That means that there's nerve damage. So as the nerve starts to get damaged, you will see either almost electric-like sensations going down to your feet. Some people will report that it's a burning sensation, and unfortunately, when it does get better, it's usually because the nerve has died. And that's certainly not the outcome that you're looking for. So if you're getting that sensation, you definitely want to see your doctor and find out what's happening. Is it because you have a pinched nerve? If it's one side that's happening, is it because the weight is so high that it's compressing the nerves? What about your sugars being so high? So if you haven't really looked at those things, it's a really important thing to make sure you go through.
Okay, we might have time for one or two more. Stage 5, 12% GFR. They're trying to avoid dialysis. How do they get rid of protein in the urine, they're having shallow breathing. Can smoking THC worsen that? So several questions there.
Okay, and so first, you definitely don't want to smoke THC. You will absolutely worsen everything. That's number one. Number two is the difficulty with trying to avoid dialysis is you run the risk of waiting too long and having the toxins do a lot of damage, not just to your brain health, but every other part of your body. So dialysis, all it's trying to do is trying to get rid of the toxins in your body. So remember the studies that were done in Japan that looked at patients who were at dialysis that were able to last for 1 to 2 years. They did an extremely low protein diet and they supplemented that to make sure that they got all their essential amino acids. They did that under the guidance of dietitians. That's number one. So they got rid of all animal products. That was really important. They made sure that their protein intake was very, very low. So they were essentially vegetarians, and some of them were even vegans. And all that being said, if you're at 5 to 12%, you need to understand a couple of things. First, if you have shallow breathing right now, that's very concerning to me. And that's a sign that we need to start dialysis. If you put off dialysis and you're at risk, it's not only bad for your health, it can absolutely kill you. And so this is why I have to urgently ask you, please, 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 see your nephrologist, your kidney specialist right away and be absolutely honest about your symptoms. If you have shallow breathing, you have to talk about it. Do not delay. And listen, as much as Michelle and I, we try to give you evidence-based answers. My advice to you is don't ever listen to anybody on YouTube and make a clinical decision about your life because somebody said you don't need to do this. It's not worth it. It's putting you and your family at risk. Our hope always is that you take this information as tools so you can discuss with your own healthcare team. But on this one, I gotta insist. You absolutely must talk to your doctor.
Yeah, and we always talk about people can feel different at different percent kidney function stages, but symptoms are one of those things that's so big and important to address with your doctor because that says a lot more about how your kidneys are doing than just what that far. So, I think if we have 1 minute left, I don't know if we have any on here. Um, how fast does GFR decline a year when you have PKD and it starts to decline? I don't know if that's a fast enough answer, Dr. Hashmi, or we need
So when you have PKD, it depends on how fast the cysts are growing. So in other words, the faster the cysts are growing, the faster they're destroying all the kidneys cells around them. It really depends on the cyst volume, and that's why you need regular imaging to be able to see what's happening there.
Gotcha. All right, it's 6 o'clock now, our time over on the West Coast. So thank you guys for joining. We will be back in August. What do we do? The third Tuesday, right? At 5:30 Pacific Standard Time. So we'll be back then. Thanks for joining. Thank you, Josh, as always, for all of your great answers and expertise. See you guys all next month.
Thanks, everybody. Bye,
Bye.
guys.